Hello, Ms. Phillips.
Hello.
Hi, I'm Dr. Medea. I'm one of the psychiatrists.
Uh-huh.
I understand that you've had some recent blood tests
Yeah.
for your prolactin levels. So I've come to talk to you a bit about the results and just to get some more information from you. Is that okay?
Yeah, that's fine.
What would you like me to call you?
Oh, Anne is
Anne.
okay, yeah.
Anne, can you tell me what your understanding of the reasons why your blood test was done?
So embarrassing. I've got, like, leaking milk sort of all the time.
I can see you finding it quite difficult to talk about and...
Yeah, it's really embarrassing. Yeah.
I can see, it must be really quite uncomfortable for you as well.
Yeah, I'm having to use breast pads and, I'm sitting with the skull. I'm just paranoid it's going to leak, yeah.
I can assure you this is something I do see quite commonly in some of my patients. And it might be that I have to ask you some personal questions. But can you tell me, for how long has this been that your breasts are leaking?
It's been about 4 weeks now.
What's coming out?
Milk, I guess. It's milky fluid.
And how much of it? I can see you covering yourself.
I feel embarrassed. I've got a big jumper on. I've got breast pads. It's just, I'm just paranoid. It feels like quite a lot, and I've got no, it's like no sense it's going to stop.
So, and you're saying this has been going on for 4 weeks, that your breasts are leaking and it's milk coming out. Have you seen any other substance or any other thing in the milk, or is it just white milk that's coming out?
It's milk, yeah.
Okay. And do your breasts feel like they've gotten larger?
Yeah, I feel heavy. Yeah.
Any pain and swelling in any of your breasts?
They just feel heavy. It's like I need the milk to come out, really.
And both your breasts, or is it just one breast? Okay, I can see it's really difficult for you to talk about, and I'm here to try and see how I can help you and discuss your blood results. So in terms of your periods, has there been any changes in your periods?
Yeah, since the last couple of months I haven't had a period.
Okay, and usually are your periods regular?
Yeah, it was almost regular before that, yeah.
Any changes in your weight?
No.
And your sex drive?
I mean, I haven't got a boyfriend at the moment, but I wouldn't be interested if I did.
So would you say it's decreased?
Yeah.
And in terms of any other physical health symptoms that you might be experiencing because of the leaking breast, have you had any headaches recently?
No.
And your sleep, has there been any changes?
No.
Any changes in your appetite?
No.
Okay. Any visual problems at all?
No.
Blurred vision?
No.
Okay. Thank you for answering those questions. Anne, when this started, you told me about 5 weeks, 4 weeks,
Yeah.
you've been having leaking of breast.
Yeah.
And it's quite uncomfortable, and your breasts have gone larger, and you've not had your periods. When this started, can you pinpoint, were there any changes going on or any changes in medication?
My risperidone was put up from 6 milligrams to 8.
Why was that?
I've started hearing voices. I've been okay up till that point on 6, but they said it probably wasn't enough, so I upped the dose.
Okay, so your medication was increased about 4 weeks ago.
About 2 months ago.
2 months ago,
yeah.
Because of the voices. And did it help for the voices?
Yeah, that's been all sorted. I've been okay that way, yeah.
Okay, and my understanding is you have been diagnosed with schizophrenia.
Yeah, that's right, yeah.
Okay, and how long have you been on medication?
Quite a long time, about 3 years now.
And have you ever experienced this before, the leaking of breast?
No, I haven't. I've never had the medication put up, but I've never had this before.
And have you ever had any pregnancies?
No.
And there's no chance that you could be pregnant because you said you didn't have your periods?
Definitely not. Yeah, and I've not got a partner, no.
Okay. And in terms of the voices, you've told me that you're not having any voices at the moment.
That's right, yeah.
Okay. And so when was the last time you had the voices?
That was 2 months ago.
So just to recap, so I've understood you correctly, you've told me that your breasts have been leaking and that coincided with the increase in your medication when you were hearing voices.
Yeah.
However, now that you've the medication increased, you no longer have any voices.
Yeah, it's worked okay for that, yeah.
Yeah, but it's affected you in the sense that you've got breast leaking and also your periods have stopped.
Yeah, that's right.
I mean, how's it all making you feel in your mood?
I mean, it's just, I feel really embarrassed. I don't want to go out. I don't feel comfortable seeing people walking around stupidly with, you know, I feel like better just sort of huddled over a scarf.
Yeah.
Just feel worried about it.
I can see, I mean, this must be quite difficult for you. What I can say from your blood results and from talking to you, the medication risperidone has caused you to have a raised prolactin in your blood.
Okay.
Have you heard about the prolactin?
No.
Okay, so prolactin is usually, it's one of the hormones in our body, and usually when that's raised, it can cause leakage of breast. It's called hyperprolactenemia when the prolactin is raised in our blood. Are you following me so far?
Yeah, that makes sense, yeah.
Okay, it's like when mothers have babies,
Right.
they end up having to nurse their babies with milk from the breast. So that's when prolactin levels get raised. So what has happened is that the risperidone actually causes this side effect of raised prolactin, and they might have explained it to you when you started taking the medication.
Yeah, probably. I can't remember. It was a while ago, so yeah.
Okay. The good news is, as difficult as it is for you now, we do have other medications, other antipsychotics that we can put you on that has a lesser chance of causing this, which is called aripiprazole.
Okay.
Yeah. So there's a chance. What we would need to do is reduce the risperidone that you're on and start the aripiprazole.
Okay.
Yeah. But in the meantime of us changing, there's a chance that you can get unwell as well.
Okay.
Yeah.
Okay.
Yeah.
Yeah.
So I'd like to speak to you again about this. Thank you for talking to me. And as I've explained to you, Anne, that obviously you've got this raised prolactin, and that's a cause for the leakage breast, but I'm hoping to change your medication so that this would stop.
Right.
Yeah?
Yeah.
Okay. Thanks, Anne.